10 on your side is hosting a special streaming report, a coronavirus digital discussion. Every Monday at this time, we have an exclusive web-only interview dedicated to the pandemic. And joining me now on Zoom is Tiffany Silmon. She is Director of Infection Prevention and Control at Chesapeake Regional Medical Center. Thank you for joining us this afternoon, Tiffany.
Oh, thank you for having me.
So, with coronavirus cases starting to increase again across the country, is that changing how Chesapeake Regional is operating at all?
Not at this time. We've been prepared, and we had our surge, we had our first surge back in the summer. And so at that time, we had infection prevention practices in place. We had that a really spike of cases around August. And so we're prepared to actually see those increases. We're prepared for that. That hasn't changed any of our practices.
So you did see that spike in August. I know Chesapeake had some of the highest numbers in the region at that time. So when you were dealing with that spike, is there anything that you guys learned, you came across that you maybe weren't expecting, or any changes that you've put into place after that spike?
Well, I think that we definitely learned a lot of lessons. One thing is that we're very fortunate that we were able to, as far as our cleaning practices, we were able to have ultraviolet technology prior to the pandemic. And so that was something that was really good to have during that time. So we put those practices in place. I think we've looked a lot at our PPE and some of the making sure that we enforce with our just with our healthcare workers about the importance of PPE and making sure that everyone wears that appropriately. So a lot of lessons learned there, because of course before the pandemic we used PPE for different things, but definitely we reinforced that during that time. We of course institute hand hygiene. We are masking everyone that comes in. We're asking our direct patient caregivers to wear face shields. So instead of just having a mask, everyone wears face shields, regardless of whether they're working with COVID patients or with non-COVID patients. Everyone wears face shields. That was something that we changed, implemented. We ramped up with our visitation and really restricted some visitor visitations to keep everyone safe. And just even down to how we dine, what we do in our break rooms, all of those little things that we think are just small things could contribute to making sure that we keep our patients, our visitors, and our staff safe. So
Interesting. So let me go back to, you made a lot of good points. You started by saying something about ultraviolet technology. Tell me about that. How does that work and what does it do?
So we use a TrueD machine. It's ultraviolet technology. We actually use it for dual reasons. The first reason we use it is to clean the room. So you put the machine actually into the room, and you turn it on. It uses light, and the timing is based on how big the room is, and it actually cleans and kills 99% of the bacteria that's in the air and on surfaces. So we were able to institute that for all of our COVID rooms, and also just for our rooms that have other healthcare associated infections. The other way we use our ultraviolet technology was to do our N95 mask. So we were able to use that for disinfecting our masks, which was a little bit unconventional, something that's very new. But again, the pandemic has allowed us to do some new things. And so we were able to set that up and reprocess our N95 masks using ultraviolet technology. And we use that along with some of the larger hospitals. Duke and University of Nebraska also have that same protocol. So we were able to do that here on site.
Well, that's interesting. I hadn't heard about that. And when we were talking in the beginning anyway, when we had these PPE shortages, I guess that really would help out. What about now, though? Do you have any kind of shortages, or do you have enough PPE? Is it because of this kind of technology that you feel like you're prepared?
Well, right now our PPE supply is stable. So we are in really good shape there. So that does help. I think the pandemic has really taught us a lot about, we don't think about things like PPE shortages and the risk of actually maybe running out of PPE. And so, but right now PPE is stable right now.
Oh, that's great. So you also spoke a little bit about visitation, and I know that if you're taking someone to the hospital now, there are rules and who can visit, or if you can have any visitors at all. Where do you stand right now with the hospital as far as visitation, and do you feel like at some point here that you might have to crack down even more again?
Right now, we are allowing one visitor. So you have one support person, and that person is allowed to come. That's one person for the entire um, duration of your hospitalization. You have one support person. If you have a surgery, you're only allowed to have one person. We're right now not allowing visitation on our COVID units, and we don't have any plans to change that at this moment. But we do have some screening at the site. So if you come in, you're going to ask a series of questions. They are doing temperature checks. We're asking everyone to wear a mask before entering. And again, we're only asking for one person to come in, and that's for the duration of your hospitalization.
And so this helps, you're trying to protect, you've got two groups really of people that you're trying to protect. You've got your patients, but also your staff, because I guess if you have a staff member that becomes ill and then other people have to quarantine around, tell me, I guess, what specifically you're doing to try to deal with that situation if a staff member becomes sick.
Well, we have a lot of measures in place right now. So if a staff member becomes sick, we automatically send them home. We have testing capabilities. So our occupational health team has done a phenomenal job. Make sure that we screen our employees. We're asking people not to report to work sick. And a lot of people have definitely adhered to that. They'll call their managers, they'll call iHealth to be screened, and just make sure that I'm safe to return to work or I can't return to work. We are definitely, the managers and the administration has really been supportive about making sure that people don't come to work sick. And that's the main thing for us, is making sure that we are keeping our employees safe and not having people return to work or come to work sick at all. And so the other thing is that our employees are required to mask when they come in the door. So it's not you wear your mask when you come to your unit, you're actually wearing your mask as soon as you enter the building, and then you do not remove your mask until you get out of the building. So we're requiring that as well. And we also implemented something called See Something, Say Something. And so we've asked our employees to be able to speak up if they're, we know there's things like PPE fatigue. So people wear PPE all day long, and it can really, it gets, weary. But we ask people to make sure to gently remind people to wear their masks appropriately. If they don't see them doing what they're supposed to do, just gently remind people to adjust your PPE or put on your PPE. Again, because we know that we've been at this now for 6, 7, 8 months. We know PPE fatigue does fit in. And so we have, and that has gone very, very well. People are well received. And sometimes people just forget, you have your mask on all day and say, wait a minute, can you pull your mask up over your nose, or it's not right, or make sure you have it on. So very well received by employees to keep everyone safe.
Yeah, a PPE fatigue. There's also something called pandemic fatigue going on out there that we've been talking about or reading about over the weekend. Do you think that is going to make it harder to do your job or to protect, the hospital and the community at large? Because like you said, people are fatigued. It's getting harder to stay in and maybe not go out and, go to a birthday party with some people that maybe you haven't seen for a long time, or to keep that mask on all the time. Do you see that as being a problem as we enter into this more typical flu season, if you will, along with the coronavirus?
And absolutely. And we know that we've even seen now in the beginning of the pandemic, it was almost easier to be able to trace where you may have picked up your coronavirus from. So I know I visited here, or someone came here. And now, because things are opening up and people are starting to relax a little bit more, we're asking our patients sometimes, do you know if you were in contact with anyone, and they can't remember? And a lot of times it's because there's multiple high-risk activities that they've engaged in, or if they've been around people, and they just, like I said, just kind of relax. As things start to open up, we have the holiday season coming. Everyone wants to visit family. And so everybody, I'm tired of wearing a mask. I don't want to, I just want to be around my family. I don't want to wear a mask. I want to be able to go out with my friends and socialize. And so what happens is that, and everybody, and you just start to relax and become more complacent. And so we definitely have seen that. I do suspect and have seen already that we'll see those effects of this pandemic fatigue, and everyone kind of getting tired of doing these things, having an effect on our inpatient census, and definitely the number of visits that we have to the ED.
Yeah. And as I mentioned a moment ago, too, with typical flu season, some hospitals get to or near capacity during a typical flu season as it is. So now when we're adding COVID on to that, do you have extra beds ready? Do you have staff on standby that may have to work overtime, or would you be hiring more people? How are you kind of handling the situation that could present itself?
So we do, in the beginning of COVID, we have an incident command team here, and we of course work with the city of Chesapeake, and we have a surge capacity plan for the hospital. And so if we need to institute that for COVID or for flu with overflow, we can definitely do that. The surge capacity plan not only allows us to plan for beds and patients, but also things like ventilators, medication, staff, and all those entities that we would need to care for patients. So we've implemented that plan. It's on standby. Again, we'll work with the city of Chesapeake and our colleagues there, and we can implement that if necessary. Absolutely.
So your job is to help with infection prevention and control within the hospital, but I guess that the community at large really could help you out in doing that job and protecting people inside the hospital as well. What do you advise for the community now that they are getting a little bit fatigued, or what can we do in a community to help?
Well, I've been doing this for quite some time now, and our infection prevention messages really haven't changed. We want people to, I know that it gets tiring. I know that it gets overwhelming sometimes to always wear a mask, but I want to encourage people not to get complacent, to be mindful that we're still in the middle of a pandemic, to not give, in the beginning of the pandemic, again, we had a lot of fear, which has now it's changed its way from fear to fatigue. And I want to tell people that just continue to be diligent about where we were in the beginning. The pandemic is not over. The virus is still here. People are still getting very sick, regardless of businesses opening up and things seeming to open up. We're still in the middle of a pandemic. Wear your mask when you go out. Wash your hands. Wipe down surfaces. Make sure that you physical distance. I encourage people as much as possible, if you can use platforms to see your family, Zoom, or my kids can tell you a bunch of them. They have to actually talk to their friends, but using those platforms sometimes instead of visiting, definitely keep our seniors and our immunocompromised people and our family safe by doing that, and sometimes distancing from them. I know it's very, very difficult. I know it's difficult, but those public health, safety, infection prevention messages that we've been pushing for years and years, don't give up. Don't get complacent. We still have a ways to go, and we don't want people to give up at this point.
And how important is a flu shot to include in that mix?
Absolutely important. So vaccination is key. With flu is this one less thing that you really have to, of course, no vaccine is 100%. We know that, but we encourage people to get vaccinated for the flu. That's something that can protect you at least from that one entity from the flu, that one disease. If we cannot, we already have COVID, and if you can get vaccinated and help eliminate your risk with flu, then that was one thing that we definitely encourage people. So please go out and get your flu shots as well.
Because if the hospital does get to a point where you're at capacity or over, again, do you see a point where visitors just would not be allowed at all?
I think that if we got to that point, we will make that decision. Definitely we'll do what is necessary to limit our transmission to our patients, visitors, and our staff. And so we would change visitation, and if necessary, we would adjust accordingly. So that may be a possibility. It's just whatever is in the best interest, of course, for our patients and those around us.
Okay.
Absolutely.
All right. And Tiffany, just one final, where do you all stand today as far as patients in the hospital with COVID?
As far as
how many patients? Do you have a patient count?
I don't have the exact patient count. I tell you, our census is fairly low.
Good.
Right now. It's not nearly where it was in August, and so it's not nearly as again where it was in August. We have a little less than 25 patients, my last count. But again, those numbers can change very rapidly, just depending on what happens from day to day.
Absolutely. All right. Tiffany Silmon, thank you so much for joining us this afternoon. I appreciate your time, and hopefully things won't get too busy for you here coming up in the fall and winter months.
Oh my goodness. Well, thank you very much. It's optimistic.
We have to be, right?
Right. Absolutely.
Right. Thanks again, Tiffany. And be sure to join us later this afternoon on Wavy News 10 beginning at 4 for a wrap up of today's digital discussion. And of course, we will have another digital discussion for you coming up next Monday at this same time. Have a great afternoon, everyone.